Hi, thanks for being here. I'm going to talk about Beyond Supplements, a physical, mental, emotional, and spiritual approach to mental health. And I am a naturopathic doctor. I'm also a wife, a mom, a sister, colleague, friend, clinic owner, author, speaker. So as I'm listing these roles, I just want you to think about the roles that you're playing in your life and your patients are playing. And if there's one that may not be serving you, because here's the thing, we are everything to everyone else. And sometimes we're not supporting ourselves in the process. So that's a recipe for burnout. And so we want to be thinking about the roles that we're playing in our life. So I'm also, as I mentioned, an author. I have additional training in 6 types of counseling. And I am blessed to have met and worked with some really important and helpful professionals in the space. So in the mental wellness, trauma, spiritual space. So this is what's informed my learning and my teaching since graduating from naturopathic school. I have written a few books, which I would love for all of you to check out, for you to incorporate into your practice with your patients, mentioning them to them that they are available. So naturopathic medicine can help with many mental health conditions, as I'm sure many of you know. And one of the key questions we want to ask with our patients is, when did things begin? Now, important to not go into the story, but to understand that beliefs get formed as a result of the experience that somebody has had. Another important question to ask is, did you feel loved by your mother or father? And also, do you love yourself or have compassion for yourself? So this is a question that I frame in terms of a 1 to 10, 10 being the best. So on a scale of 1 to 10, how much do you love yourself? And the slightly different question is having compassion for themselves. If they answer no to feeling loved by their mother or father, this is insight and information for you to know that likely there's a disruption between the attachment, attunement, and authenticity, developmental needs of a child. So as clinicians, we have to become trauma aware, and we can become trauma informed. And if we like, we can become trauma educated. But we definitely need to have our finger on the pulse around this concept of trauma. Now, it doesn't have to be something that you dive into in terms of going into the story. Like I said, you don't need to necessarily do that. But what you want to be aware of is, was there a disruption here? Dr. Gabor Mate, one of my teachers, says that trauma is not what happened to you, but rather, what did you make the experience mean? What beliefs did you form as a result of that experience? Now, I can tell you, he interviewed me for his book, The Myth of Normal. And one of the questions he asked me was, in all of my experience as a patient navigating the mental health system, did anybody ever ask me about the role that trauma played in my mental health? And I can tell you the answer is no. Not one psychiatrist, not one naturopathic doctor, not one person ever asked me about the role of trauma. So again, you don't have to get into the story, but you have to understand that trauma sets a person up for certain beliefs. And these beliefs can be core, limited, or in the subconscious. 90% of our mind is run by the subconscious mind. Or another word I use is unconscious commitments. So you know that there's an unconscious commitment running the show in your patient's life if they say they want something, but they never do it. So for example, the person that wants to lose weight comes to you year after year because they want to lose weight, but they then never get off the couch. So there's something running the show lurking in the recesses of our subconscious mind that we are more committed to than what we say we are in the moment. And it takes time to uncover these for people. but it's important work. Dr. Bruce Perry says that trauma is not what is wrong with you, but what happened to you. So reframing the question from what is wrong with a person to inquiring from a place of curiosity, what happened to you? And remember that the intrauterine environment can play a role here. Intergenerational trauma plays a role. But when we're in the uterine environment, the developmental state of our mother and what's happening to our mother affects the newborn that's being formed. And Dr. Dixon Tom talks about how the neuroendocrine system is developing between birth and 7 years of age. So we really want to understand if there was a disruption during this time, that it can affect somebody energetically on an endocrine level. So to speak to this idea of genetics versus epigenetics, this is a really important piece, was important for me in my belief and I think in my healing, because I never subscribed to the genetic theory of mental health. So Dr. Mate says that neurological and emotional wiring begins in utero. Therefore, the mental and emotional state of your mother or the person who carried you to birth results in important biological imprinting. Now, I'm just going to add as well here that this is not just the mother. This is the environment. There was a study actually done in Sweden, and they measured the mental health state of the father, and that actually impacted the child. So this is not just women, because women tend to take a lot of blame. And I really want to set the stage here that this is not just women. Okay. It's also the mental and emotional state of the father can play a role here as well. And in my book, I open with a discussion from Gabor Mate that says the important point to explore here is how stresses during pregnancy can already begin to program a predisposition to addiction and mental health challenges in the developing human being. Such information places the whole issue of prenatal care in a new light and helps explain the well-known fact that adopted children are at a greater risk for all kinds of problems that predispose to addictions. The biological parents of an adopted child have a major epigenetic effect on the developing fetus. So numerous studies have found that maternal stress, and again, remember paternal as well, or anxiety during pregnancy can lead to a broad range of problems in the offspring. So from a book by Mark Wallen, which is called It Didn't Start With You, the emotional history you share with your family began even before you were conceived. When your grandmother was 5 months pregnant with your mother, the egg that will eventually become you was already present in your mother's womb, represented by that heart in the image. That means you, your mother, and your grandmother all shared the same biological environment. Whatever your grandmother experienced, her traumas, sadness, and grief can become your emotional inheritance. Now, Christiane Northrup goes on to say that we are actually the culmination of the 7 generations that have gone before us. So very interesting to keep this in mind. So when we're come into the world as children, we may already be predisposed, depending on the prenatal environment, to higher levels of cortisol, perhaps, to being more sensitive, more anxious, have difficulty sleeping. But as we're gaining, growing into the world, the 3 A's are important to pay attention to. So the 3 A's for children for development are attachment, attunement, and authenticity. So the question then becomes, what happens when our attachment need is not compatible with our need for authenticity? And this is what happens in trauma. So to give you an example of this, how this plays out. So say you're growing up in an environment with an alcoholic father, and you come home from school and you're super excited because you won an award. And so you're just bouncing with joy off the walls. And your father asks you to be quiet, and you don't, because you're just bursting, and he then hits you, and you go to your room and you're upset. Now, what do you think you're going to do the next time you come home and you're excited, and your father's not prepared to receive that excitement? Do you think that you're going to express it or suppress it? And the chances are you're now going to suppress it, because it's not safe for you to be authentically emotional with an adult who is responsible for your care. That attachment need trumps the need for authenticity. So we end up suppressing ourselves. So the message that gets conveyed to children very often is that they aren't acceptable the way they are with their emotions. And so what does the child then do? They choose attachment over authenticity because their life depends on somebody caring for them. Attachment is necessary for survival. So our need for authenticity becomes suppressed, and that is how emotional dysregulation begins. And we have this tragic conflict. We end up suppressing ourselves. The emotional repression and disconnection from our authentic emotional experience begins, and we choose attachment over authenticity. And the outcomes become, down the road, loneliness, mental illness, physical illness, and addiction. Now, it can be difficult to navigate our emotions and our thoughts and our relationships. And it can be difficult to connect with and understand ourselves, let alone others. And when we grow up in an environment where attachment is threatened, we operate with feelings of feeling insecure or unsafe. And so then we operate from this place often of reactivity, defensiveness, in a state of fight, flight, freeze, fear, or fawn. And at the end of the day, we don't perceive things as they are. We perceive things as we are. So when you're talking to your patient who happens to be a 55-year-old male, you're talking to a 5-year-old male housed in a 55-year-old body. So whenever that insult to injury occurred is the emotional development age of that individual sitting across the table from you. So Gabor goes on to say here that virtually everything that is wrong with your patients began as a compensation, as a survival mechanism in childhood. Therefore, it deserves nothing but respect and compassion. So growing scientific evidence demonstrates that social and physical environments that threaten human development because of scarcity, stress, or instability can lead to short-term physiological and psychological adjustments that are necessary for immediate survival and adaptation, but which may come at a significant cost to long-term outcomes in learning, behavior, health, and longevity. So the way that children adapt to early stress helps them endure those difficult times, but these same coping mechanisms that help you endure then become a source of dysfunction. So we don't want to make people wrong for behaving the way they behave, but we want to get behind the behavior. What's behind that? What's underneath it? So we want to help them see the value that that same behavioral response played in their life. And that's the subject of compassionate inquiry. So now it's no longer the willful, appalling dysfunction of a 55-year-old adult male who can't seem to get it together. It's actually the desperate survival measure of a threatened child. And as soon as you make that paradigm shift, you've got a totally different view of yourself and a totally different view of the other. He goes on to say that what I'm saying is that all diagnoses begin as coping mechanisms. At some point, there's something about them that served as some survival value. Furthermore, diagnoses don't explain anything. They describe things, but they don't explain things. The explanation is always rooted in some earlier experience that predates the diagnosis. That's why I called my book Beyond the label. So if you are not using the ACE questionnaire developed by Vincent Folletti, I encourage you to do so. This is a very simple questionnaire that gives you some insight as to whether or not trauma is playing a role. A score of 4 or more indicates that trauma is a factor. My ACE questionnaire is 6. But again, nobody ever asked me. So it's really important as NDs that we get this piece. It's more important to understand everything about your patient because we practice individualized medicine and our job is to instill hope. We also want people to understand that there is an explanation for what they are experiencing, and we can help them move beyond the label to a place of mental wellness. So just a quick introduction about myself. So I have had a lot of mental health diagnoses, from anxiety, depression, 3 suicide attempts, bipolar disorder type 1, which includes 6 psychotic events, also bulimia, and I'm going to throw in a little bit of ADD and OCD in there too. Why not? So I've spent a year of my life in psychiatric hospital care, actually graduated from my UBC commerce degree. I was the valedictorian, but I also spent the last 3 months going to university on a day pass from the psych ward. Now, I have a trauma, which was that I'm adopted. Now, I also did a lot of antibiotics in my high school years to treat acne. And so I just want to mention, because we know that there is a gut-brain relationship. So I want to mention that because you have to take a proper, thorough case history. This didn't come to my attention till I was well into my 40s, this connection between the gut and the brain. So just some research there for you. So after my first suicide attempt, I was left in a rough state, and I was in a coma. My kidneys had failed. I was told I need a kidney transplant. So here I am. I'm in the hospital. I'm recovering, and I can tell you, when I opened my eyes from that coma, I was not depression-free. If anything, I had sunk worse into a deeper depression, because now all the failure pieces of the puzzle were coming to the forefront. The fact that, wow, how come I'm still here? How come I'm still here? So my friend gave me a book to read, and there is this quote on surrender that I share with you, which is, surrender means the decision to stop fighting the world and to start loving it instead. It's a gentle liberation from pain. But liberation isn't about breaking out of anything. It's a gentle melting into who we really are. We let down our armor, and we are simply asked to shift focus and take on a more gentle perception. That's all God needs. Just one sincere, surrendered moment when love matters more than anything, and we know that nothing else really matters at all. So what do you think the key word was in that quote for me? And the key word was love. That was a foreign concept to me. That was a foreign concept. I was the furthest from love. Anyone who is wanting to end their lives, I can guarantee you, has zero self-compassion and zero love for themselves. So that's our job, to stop the war that's raging within, to guide people back to themselves from a place of love and compassion. So here's the treatment overview. When I'm working with people, explain, look, there's 4 aspects to you: physical, mental, emotional, and spiritual. Our Western system is focused on the physical level, and many naturopathic doctors are as well. But we need to look at the whole pie here, all the pieces of the puzzle, not just simply the physical level. Then with that, though, if we are going to start on the physical level, we want to understand there's 3 macro systems: neurotransmitters, your neuroendocrine system, and your organs of detoxification, and your immune system. So where are you going to start as a clinician? You got to start somewhere. What are you going to start? So for me, this is where I started as a patient. I started with taking a bunch of nutraceuticals. I was taking 5 psychotropic meds at the time. that I went to see my nutritionally oriented psychiatrist named Abraham Hoffer and my naturopathic doctor, Dr. Larry Chan. So here's the thing. These are the 10 areas that I talk about in my book. And the physical foundation starts with nutrition, sleep, exercise, and then managing stress. Then we want to work on the rest of it. And I'm going to talk about some of these pieces today for you, the thoughts and the emotions, etc. So this is what it looks like for me from visits 1 to 15 of what I'm working on with people. So that's how it looks in practice. Oops, sorry. So today I'm going to talk about this foundational practice, what I call the 5 R's of working with problematic thoughts. So what I want you to understand is that most people are living from the neck up, and they are either left or right-sided in their thinking, and they're discounting their body. So what happens is we have a thought that then results in a feeling and emotion. Then that leads to another thought, which leads to another emotion. And we go round and round and round. And we can remain stuck in depression, anxiety, anger, OCD, addiction, etc. At some point here, we want to understand that we have to interrupt this cycle by using a mind, body, spirit approach. So mind is another word for where you hold your thoughts. Body is where you hold the emotions. So we have that in that previous slide. That's your thought, emotion, cycle, spiral that we get stuck in. And I can tell you, every episode I've had, depression or psychotic, started with a thought. Okay. And all I did was follow the thoughts round and round, down and down into the depths of depression, suicidal despair, or up into mania. So we want to bring in the piece of the puzzle here that's missing, which is this idea of spirit. And what I mean by that is one word, has nothing to do with religion. The word for spirit here is the word breath. Okay, so this is the framework. The first step here is to recognize your thoughts. We want to bring some awareness to the nature of our thoughts. Refrain from following them if they are leading us in a direction that is not helpful. And we refrain by relaxing into the breath or getting in the gap between one thought and the next. 4th step is we're going to repeat steps 1, 2, and 3 continuously if needed. And the 5th is from cognitive behavioral therapy and also psychoneuroimmunology, which is we want to rephrase the thought that we recognized. So we'll just walk you through this a little bit more deeper. So first thing, we got to gain some insight or awareness into what somebody is thinking. So I'm a recovering overachiever, and that was because I felt a deep sense of a lack stemming from the belief that resulted when I learned that I was adopted. The belief that I formed, whether it was right or wrong, doesn't matter. The belief that drove me was that I wasn't wanted, I wasn't good enough, I wasn't worthy, I wasn't fill in the blank enough. Okay, so that led me to become an overachiever. And that served me super well, absolutely, until it didn't. Okay, and there's this fine line with your patients. So what are they thinking? Basically, without awareness of what and how you're thinking, this can be a limited factor in regaining somebody's mental health. So when you recognize that you're stuck in a thought pattern that's unsupportive, etc., then we're going to refrain from following them. We don't need to ask the question why here. We just need to stop the train, if you will. And we're going to do that by relaxing into the breath. Now, just like I said, everybody is living from the neck up. Most people are breathing just with the top of their lungs, but your lungs go all the way down to your diaphragm. And when you take a proper diaphragmatic breath, engage in that diaphragm, pulling that diaphragm down, what is sitting right underneath your diaphragm? It's your adrenal glands. So you are physiologically designed to calm yourself down if we only take the time to take a proper diaphragmatic deep inhalation. And also, when you're breathing through your nose, you send a little bit of a turbine action to your sella turcica, very thin membrane between the nose and the brain and the sella turcica, which houses your hypothalamus and pituitary, which is the master gland that controls this whole adrenal HPA axis. So the breath, really important. The other thing I'll just highlight here is most of us have taken CPR. We learned the ABCs, right? 2 things for airway and then breathing before we are even concerned about circulation. And when a baby's born, the first thing we ask is, did that baby take their first breath? And at the end of somebody's life, their last breath. I've never heard anybody say they took their last heartbeat, right? So inspire, the Latin definition of this, or the definition of the word inspire, means to breathe in or impart wisdom or reason to a human soul. And it's just so beautiful. So basically, there's only two states, sympathetic or parasympathetic, right? We can use the word beautiful or suffering. We can use other words like this, stressed or relaxed. Your patients are going to understand that. What side are you on? Hurt or help? Sabotage or support? So bring awareness, because the king system in your body is the nervous system. You have to guide your patients from sympathetic to parasympathetic. So I ask my patients this: if this is 100%, give me the breakdown. On average, where are you spending most of your time? 90-10, 70-30? I have yet to say anybody to tell me that they're more than 50% in a parasympathetic state. And the reason why this is so important is because when does digestion happen? Everyone's focused on the food. Don't eat wheat, don't eat sugar, don't eat dairy. However, who's talking about the state in which you're in when you're eating this food? Because if you are in a stressed out sympathetic state, how much benefit are you truly getting from your nutrition? So what is the dominant state? At the end of the day, you can only be in one state at a time. So love or fear. And so the whole goal in my work with patients is to guide them to love, compassion, confidence, and ultimately safety within their body and security. So why do we want to use compassion? Because its driving force is love, not fear. Unlike self-criticism, which asks if you're good enough, self-compassion asks, what's good for you? It's another powerful reframe. So when we're taking the breath, we're going to put our right hand on our belly button and our left hand on our heart. And we're going to do this. I'm going to skip through the reasons why here, but I do want you to understand that there's more serotonin receptors between these two hands, right hand on the belly button, left hand on the heart, than there is in your brain. Okay, so we want to put our hands here, and I do this in the office with patients. And then we look out in nature, out my window, and we stare at a leaf or a tree or a branch or a cloud. So we're going to do this together right now. You're going to plant your feet on the ground, right hand on the belly button, left hand on the heart, stare at this leaf and breathe in. And we're going to take 2 deep breaths. So breathing in and out. And another deep breath in and out. So perfect. So if you were in the office with me, the next thing I'd do is I turn to my patient and I say, anything going on in your mind when we were taking those 2 deep breaths together? And many times they say no. And I say, awesome. That's where I want you to be, in the gap. So we have to repeat this. Okay, taking 2 deep breaths together one time in the office is not going to be enough to develop the muscle to rewire your brain. But we need to keep practicing this over and over again. Okay, if you want to tone bicep, you're not going to lift 1 10-pound weight and do 1 repetition. Okay, so we're in training here, training our mind. So this last step comes from cognitive behavioral therapy. So basically, we want to take a look at the thought that we recognized, and we want to rephrase it if possible. Now, I can tell you that I think I struggled for probably 20 years longer than I needed to, because I was so resistant to this idea. I felt like saying affirmations was like spraying whipping cream on a pile of bologna. Okay, I really was not open to this at all. However, I did not know about psychoneuroimmunology, which means your thoughts affect your physiology. So we want to understand the technology of the brain and how it works and how it's related to our beliefs. But here's the thing. Nowhere in psychoneuroimmunology does it say that you have to believe the thought you're thinking. But what you want to understand is your thoughts create neuropeptides. Neuropeptides affect the hormones that get produced. The hormones that get produced signal the nervous system to go into sympathetic or parasympathetic. And that affects how you feel. So nowhere is it about belief. Now, if you're going to be like me, and your patients most likely will be, then if it's too hard, if we use the example, I am unworthy, if it's too hard to go to I am worthy, then just stay neutral. Okay, the rephrase in that example would simply be, I am, and you do not fill in the blank. Okay, and I am actually is a very powerful statement. I have a video that actually Lachlan, who many of you might know, helped me with. And so that you can search on YouTube. It's great for you to use with your patients to explain psychoneuroimmunology. And that creates neuroplasticity. So we want to understand that we can create a new brain here. I use this bus analogy. You might find it helpful with your patients. So here's the thing. The bus is your brain, okay? The driver of the bus is your heart or your soul. And the passengers that are riding on the bus are represented by a pen here that you can't see me because I don't have my video. But anyway, a pen is representing a thought here. So what we're teaching people with this approach is to get discerning about the thoughts that you're thinking. Take the thought out and take a look at it. Because here's the thing. And decide, okay, is this thought serving me right now or sabotaging me? Is it helping me or not? Do I even need to carry this bus, or sorry, do I even need to carry this thought with me as I'm driving my bus down the road of life? Is this something I can leave on the side of the road, perhaps? Because here's the thing, there's so little you can control. You can't control the weather. You can't control your boss. You can't control whether there's a pandemic. You can't control the person sitting next to you, but you can control what you think. You're in charge of that. You're driving the bus. You're not at the mercy of your mind. So here's the thing. I was at the mercy of my mind. I was immersed in the cloud of depression for most of my 20s and my 30s. Okay. I couldn't see through the cloud, but here's the thing. I'm the sky. Okay. The sky is, or the sun is behind you. It's always there, shining. You might get stuck in the cloud for a while, but the cloud will lift eventually. It will. It has for me. And then we can navigate the storms of our lives a lot easier when we have tools to do so. But until somebody teaches you how to do this, it's really difficult because you believe every thought you have, you believe you're unworthy, you believe all the negative stories that are going on in your mind based on the experiences of your life. So here's how I prescribe this. First and foremost, we want to start bringing in awareness to our thoughts and asking the question and get discerning. Okay. Obviously, a lot of these problematic thoughts come from trauma. Okay. That's, if you don't feel comfortable going through that with your patients, then definitely, obviously, have a psychologist on side. But you can still teach them this. You can still teach them how to bring awareness to if their thought is helpful or not. And you can explain the physiological cascade and how that affects their hormones. 2 more deep breaths before you eat, before you go to sleep, when you wake up, after you go to the bathroom, standing around. Everybody fills the space with their phones. Don't do that. Just be. Okay, so anxiety doesn't have a chance to rise when you reset the nervous system constantly with the breath. And we're teaching people here to live where? In the present moment. There's 3 places people can live: past, present, and future. And most of us are not living in the present moment. So we need to help people get back to the present moment. So now on the emotion side, what I do with this is I show this chart. It's also in my book. And I just ask, where show me your set point lately, is what I say to my patients, just to get a sense. But I explain to them, look, no emotion is good or bad. Okay, that's the ego mind that is projecting onto you. No emotion is good or bad. Emotions are just energy in motion. And we don't want to actually suppress the emotions. When I met with Gabor, he interviewed me for his book, The Myth of Normal. He asked me, Chris, what emotion have you depressed? What have you suppressed? Depressed. What have you pushed down? So Another teacher of mine says depression is deep rest. We need deep rest. So understand the emotions, and a lot of people are afraid of them, but we want to destigmatize that as well. So this idea that you should be free from or never have an emotion is really not true. Okay, you have them. These emotions are like your children. They include rage and doubt and sadness. They are all yours. They come to you because you are their home. Many people ask, well, how do I get from here to healing? Well, understand that sadness does not want to be healed, or insert any emotion here, anger, rage, okay, doesn't want to be healed. It actually wants to be held. The word heal and the word whole come from the same root. So listen, when I learned this, most of my life, I felt that I got the message from the Western medical world that I had a big dark stain on me. Do not tell anybody ever that you have bipolar disorder. Okay, do not share that. Okay, because you're going to be treated differently, ostracized, not included, rejected. You won't get that promotion. That's for sure. So I walked around disowning these aspects of myself, rejecting these aspects of myself. It wasn't until I sat with Jeff Foster, who these words are from, and he shared that these are parts of you. And right now you're casting them aside. You're locking them out, and they're begging to be seen. So if you can shine the light of love on these parts of yourself that you're disowning, that's when things will resolve. And so I had to learn how to hold these parts of myself that I didn't like. So these emotions are residing in you, and you are presence itself. You are that home. So again, all these children come to visit you, and if your heart is open, why does that ever have to stop? And we always think in terms of getting there. Even healing becomes the new goal. If your heart is open, sadness and doubt can come and visit and can go. Remember, they don't want to be healed. They want to be held. And that's how you break the violence with yourself. So the next time sadness child comes to visit, instead of saying, why are you here? And pushing it away with an antidepressant like we all do, instead we say, oh, you are here. Remember that it's okay to hold it in your presence. That's how you break this cycle of karma. So emotions are only going to live generally for about 2 minutes, according to Jill Bolte Taylor in her book, My Stroke of Insight. So we want to learn to express them, not feel them with thought. We definitely don't want to suppress them. So additional areas that I think that are really important to work on this mental, emotional, spiritual realm is boundaries, our beliefs, core, limiting, and shadow, the unconscious commitments, our triggers, our reactivity, love languages, taking things personally, making assumptions, etc. Acceptance and forgiveness. These are all pieces of the healing puzzle. I'm not going to get to each one of these is worthy of a 2-hour lecture in and of themselves. So I just want to speak to emotional activation and reactivity. So consider the metaphor of a trigger. When you consider a gun, how big a part of that mechanism is the trigger? It's actually a small part. And the biggest part is the weapon, the bullet, the explosiveness inside the weapon. The trigger itself is tiny. Then there's this much larger mechanism. So you can be focused on the trigger, which is the immediate moment, or you can put your attention on the whole mechanism, the whole dynamic. So if you are triggered or activated or upset, it's because you were a gun ready to fire. So the rich learning is getting curious about what is that ammunition in me. So I don't know about you, but and maybe you can let me know in the Q&A when we meet, but sometimes I'm activated with my patients, touches something in me. And Gabor taught me to pay attention to what's going on in me. When I was at naturopathic school, they taught me to pay attention to what's going on with the patient. But nobody ever taught me to pay attention to what's going on within me when I'm with the patient. And so if you're activated when you, and maybe you guys are all Rinpoches and way more spiritually evolved than me, which is awesome. But I have had to learn how to work on my own stuff, if you will. So that's why I encourage everyone to be working with somebody who can help them. Because if you notice that you're upset when somebody cancels or doesn't show or has a different viewpoint than you, then that's about you, not them. So the road to recovery, right? It is not, most people want to get from here to healing yesterday. And the reality is it's a journey, as I said, and there's a lot of learning to happen on this journey of life that we're all on together. And the most important thing is that you are on the road, not that there's not bumps and potholes and beautiful mountain peaks to climb. There's going to be ups and downs in life, but it's all about the emotional intelligence that you carry, you've learned and developed to navigate life. So I like this message from Oprah. First, the lesson comes to you in the form of a tiny pebble, then a larger rock hits you on the head, and then a boulder, and finally the entire brick house might come crashing down for you to get the lesson. And so I look at all of my episodes as lessons for me to be able to ultimately get back to the basic, which is learn how to love myself and others. I think that we're only here for two things at the end of the day, to give love and to receive love. And I can tell you, I wasn't very good at either one of those. So I've had to learn how to, these are the lessons for me, which you can read about. And lastly, I'll finish with this. This is from the Journal of Naturopathic Medicine. So many people believe that, again, just in the biochemical theory of mental health, I would really actually encourage you to move beyond that. And actually, there was an article in Nature of July 2022, I believe, that actually said that the serotonin theory is actually not true. So that's interesting, because that's what we've been told for since 1980. So I'm not going to deny that there can be a physical and causal connection between neurotransmitters and hormones and, organs and detoxification. So again, physical level is important. Don't get me wrong. That's where I started. But my out there view is that our spirit is trying to get our attention because some aspect of our lives is not moving in concert with our spirit or divine plan. So understand that the human being is not simply a physical entity. We have minds and we think. We have emotions and we feel, and we translate these feelings into meaning. We are spiritual beings, and causes of disease manifest in 4 groups or levels. Of these, the spirit is the center. The next layer, mental, then emotional, physical. So if there is a distortion on the spiritual level, it will create distortion through the system, like ripples from a stone thrown into a pond. So start with your patients somewhere. And hopefully you can start by introducing this one tool that I've taught you today about looking at our thoughts, just simply paying attention. Break it down. If you want to make it even simpler, just say, I want you to pay attention to whether your thought is serving you or sabotaging you. That's it. Just bring some awareness. That's all you have to do to begin. Understand that it's our feelings about ourselves and how we treat ourselves that is critical to our mental health and well-being. So again, asking that question, bringing this back to how can you teach your patients to love themselves? Okay, so our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. So it is our light, not our darkness, that most frightens us. And we ask ourselves, who am I to be brilliant, gorgeous, talented, and fabulous? Well, actually, who are you not to be? Okay, your playing small does not serve the world. And, you can just say this out loud with me. I really think that our playing small as a profession does not serve the world. The world needs us. So there is nothing enlightened about shrinking so that other people won't feel insecure around you. We are all meant to shine as children do. And as we let our light shine, we unconsciously give other people permission to do the same. And as we are liberated from our own fear, our presence automatically liberates others. So as a clinician, it's really important for you to move through your own self-doubts, fears, criticisms, and learn to embrace love for yourself. It's really important. I think this is the work that we all have to set about doing. I know for myself, that has been, I think, a key to my success, if you will. I mean, my vulnerability and my ability to share my experience as a patient, to let my ego not run the show, to no longer live in fear, to not be scared or ashamed of the diagnoses that I've been given, because they have served to inform me to get to this place of healing. So I think I'm out of time, but I've put a case study here that you'll have the slides that you can read through and can ask me questions about. It's pretty self-explanatory here, and I just go through each visit. So I'll just move sort of through this now, and I'm just going to leave you with, this is a poem that I wrote when I learned about Robin Williams passing away. This is what came to me. So this is my philosophy. So open, see, feel, believe, change. So open your mind, open your eyes, open your heart to the belief that change can happen. See in your mind, see in your eyes, see in your heart the change happening. Feel through your mind, feel through your eyes, feel through your heart, a change in belief. Open, see, feel, believe, change. If you want to work further with me to take a deeper dive into some of the steps that we've talked about today, then I do have a mental health clinician course, and I am going to be doing a in-person 10-week live version of that in January. It's available now. If you want to get a head start, you can sign up for that on my website. And my books are available, wholesale pricing for clinicians. If that's something that is of interest to you, many clinics do carry my books, particularly The Essential Diet, as well as Beyond the Label. And please stay in touch. And I look forward to talking with you at the conference.